Welcome to Nurse to Health, the podcast where we take you behind the scenes and to the front lines of healthcare and healthcare education. Nurse to Health is brought to you from the studios of WRHU at Hofstra University in collaboration with the Hofstra Northwell School of Nursing and Physician Assistant Studies. I'm Dr. Bob Gluck.
And I'm Dr. Kareem Nugdalla. And today we're delighted and honored to be joined by Dr. Kathy Gallo, founding dean of the Hofstra Northwell School of Nursing and Physician Assistant Studies and Chief Learning Officer for Northwell Health and Executive Vice President.
You've done so much in your career, it's hard to know how to introduce you. Why don't we start out by opening that up to you? You've been all over the place. You've done everything.
Yeah, which is how I like it.
How do you introduce yourself?
Well, it depends. So if I'm with my grandchildren, it's Grandma. If I'm home with my husband, it's, Kathy. But this is fine. If it's professional presentation, it's Dr. Gallo. So, it's all situational. Okay. Kathy is fine since we're old colleagues and my former student, Kareem.
Yeah, really. No, hey, listen, you're the one who brought me into the nursing school. I remember it well. I mean, I was over at the med school part-time. I sort of had this sudden career change, had a bad accident, and I couldn't operate anymore. I didn't know what I was going to do with myself. I have 3 kids, a mortgage, and all the rest of that, and ended up at the med school doing a lot over there, but no benefits on a part-time salary. And then I got a call from either you or Renee, I think it was, said, why don't you come over to Shapiro? We're expanding, we're doing big things. You could be part of that. And I said, I'll be right over. And I literally showed up said, where do I sign?
Right, suitcase in hand. Well, the important thing, the school from the beginning for me was to make sure we had an interprofessional program, interprofessional faculty, because that's how we practice, right? And patient shows up and there's an interprofessional team. That's exactly what I wanted the students to experience right from the get-go. So you were a great welcome.
Look, I've never formally thanked you, but thank you because it's been an incredible experience. And we're going to dive into a bunch of that stuff that you just touched on because it's been a big part of who you are and what you've done in terms of Chief Learning Officer. I mean, you guys sort of invented that, not the concept, because I guess GE and Motorola and whoever in industry.
We took it from the
industry. But in terms of healthcare,
yes,
it was you and Michael Dowling who sort of, why don't you talk about that?
Yeah, careers are not a straight path, I tell everybody. You never know where you're going to wind up. I never thought I'd wind up to be a dean or a chief learning officer, right? I essentially grew up in emergency medicine. Between Stony Brook and North Shore, I was the director of and administrator for their emergency departments. Learned a lot.
Which, by the way, sorry to interrupt, but just for our listening audience, so North Shore at the time, because I started way back with LIJ, Long Island Jewish, in the late 70s or early 80s. And so it was basically, it was North Shore LIJ, had the collaboration, which now grew into
Northwell Health.
Right. So
yes.
So I'm sorry to interrupt.
No, that's okay. I was there from the ground up, which I really appreciate because I've learned so much in terms of acquisitions and mergers and, trying to create a culture. While each individual hospital has its own culture, you need an overriding corporate culture and values that sit on that, even with today's merger with Nuance Health up in Connecticut.
Yeah. Right.
So Mike Dowling put me on the board. So I'm on the board at Nuance to help with the integration. We'll learn from them, and they'll learn from us, as we always do. So anyway, I've just been, a lot of luck, fortunate, and I never intended to be a nurse. When I was a young person, I wanted to run a business. One of my brothers actually was with Ford Motor Company through his whole career and wanted to be one of the presidents. So I was always exposed to that, even though my father and my other brother were in construction.
Well, we've just had a whole conversation about that. Evidently, you and Kareem and John Mullen, who's our engineer, share that.
Right. Exactly.
Yeah.
But from my perspective, when you're leading a unit and you have employees and you have customers, so at the Center for Learning and Innovation, my customers were not only the clinical teams that came or any employee in a leadership development program, they were the customer. Their bosses were the customer, right? And the leadership for Northwell were the customers because of the resources that they gave us. Right. I'm always goal-driven and outcome-focused, not process-focused. You change your process to get to your outcome. But you have to achieve things at the end of the day and not just talk about them.
Yeah.
We did the same with the nursing school. When Mike Dowling always wanted a nursing school as a recruitment feeder to Northwell, my approach was as a business, because you have employees, you have customers, essentially, are not only your students, but who's paying for the tuition? If it's an employer, parents. But once you have employees and customers and a service, that's a business. That's always how I approached it. After my PhD, I went and got an MBA.
Yeah, I mean, we're going to circle back to Center for Learning, Patient Safety Institute, the school. I mean, you've done it all. I'm obliged to bring up something. I had a meeting with you at one point over in Shapiro, and you told me something. I was all about trying to do everything and anything, and you made one comment, which was something about trying to boil the ocean.
Right.
You know, at the time, I was like, oh, geez, whatever. But, it was such a right-on comment. It was real. Basically trying to accomplish too much too fast to accomplish the impossible. But I get the feeling, and you'll correct me if I'm wrong, that, I'm a person who doesn't always follow their own advice. And I'm looking at you and everything you've done. You've boiled the ocean. I mean, have you done it 1 teaspoon at a time?
No. I mean, in the beginning, I would work too fast. But that was my emergency medicine background. I'm like,
quick.
Everything's stat. And actually, it was Mike Dowling that told me timing and patience. And you have to bring people on board. There'll always be those that just aren't going to go. What I learned from that was don't spend a lot of time on them. Focus on the folks that need to move with you and aren't there yet. And then, of course, you always have your quick adapters. They're like, let's go. I learn every day because I love learning, but I learned a lot in terms of how to do what I was asked to do. I didn't come from a place that had that skill set, so I had to learn it.
Right. How much did that business degree help?
First, you have it so you can sit at the table.
You mean so people take you seriously?
Because you have to be able to talk to the chief financial officer.
Talk the language.
Correct.
Right.
You have to know what you're talking about. You have to know how to manage a budget, how to put one together, how to manage it.
Get grants. We just had a whole conversation about the Ideals grant, which you were a big part of.
$10 million worth of grants for the school. It's how do you develop that business acumen and the business plan? And you learn that you don't need 100% of the information to make a decision. Right. 80% is good enough. You know that clinically, right? And then you course correct as you go along. Right. Yeah.
Just thinking back many years ago, myself, I was working on a heart failure unit in Manhasset, and I remember getting an email about a nurse practitioner program that Northwell was going to be starting up. I said, wow, man, I'm working on this day. What can I do? I'm begging my manager. She, God bless her, she let me go early. So I get there. It's like 200 community drive, and you're there, right? And you're doing this huge presentation. It's a large auditorium. Lights are on. There's all these screens, and there's a PowerPoint. And, man, it was so professional. I was hooked the second that I heard you speak about this program and what it was going to do for healthcare, for nurse practitioner, the profession itself. I was just like, I have to go to this school. So I just want to know for myself, what was the inspiration to start the NP program in the first place? How do we even get to it?
It's what the business needed. That's what Northwell needed at the time. It needed an influx of nurse practitioners. So I told everybody, it'll take 3 years till we get that first graduating class out. The same with the nurse anesthesia program. We just didn't decide to do that off the top of our heads because we had nothing to do. Northwell was starting anesthesia business. You need nurse anesthetists for
workforce.
Yeah. It's all based on what the employer needs. I mean, that's what businesses do. To put out graduates that can't find a job, why would you take somebody's tuition to do that?
I can appreciate the workforce requirement. When I compare the curriculum and the way that it was delivered, in comparison to other NP schools, not to throw shade on them, but you're talking about pearls.
Yes.
You're talking about bio skills, the cadaver lab, simulation.
Right.
Where did that come from? Because this is like cutting edge.
I'll back up a bit. So our Patient Safety Institute, which is our interprofessional clinical simulation center.
Which let me invite you to just explain just the physical space and all, because people out there are just not going to really appreciate. So, and we have this. It's a building over Lakeville Road, and
Right.
talk a little bit about the actual space. So
Yeah,
people know what we're talking
right.
about.
We built, actually, that was our 5th build because we grew so quickly. There's 2 floors with patient rooms, fully equipped like a patient room would be, with high-fidelity simulators, software that you can build real cases, and many times quality would give us a case to build so they could look for any gaps in care, et cetera. And then we would partner with the department's educator. So whether it was critical care for our fellowship program, we would have the critical care nurse educator with us and our team building the curriculum. We always worked with the hospitals or cardiac surgery. That team would come over. Dr. Hartman would give us his educator, and the cases would be built. Emergency medicine, the same thing. So it was always working collaboratively. While the simulation is important, the debriefing is more important because everything is audio and video recorded, and the teams can sit back. The PSI team will facilitate the conversation, but not give the answers, and let the team look at how they perform.
Yeah, so we basically, we have, like you said, we have a setting, could be just a hospital room.
Yeah.
We have a patient in there, and there's a group of students around the bedside. There's a high-fidelity mannequin, and faculty is sitting on the other side of a two-way mirror, one-way mirror, and so we could see them. They can't see us. We can listen. They ask questions like you would in a normal patient encounter, and so the faculty or the operator at the console is going to give answers. And then, so they run this scenario and basically making all the mistakes
Yes.
that people are going to make when they're learning.
That's right.
But not on a real patient.
Right.
Right?
Right.
So, that doesn't work real well, if you're practicing on real people. So, and then, like you said, come out and talk about what went well. And
right.
Go ahead,
What
take it
can
from
we do
there.
better? Now, where we got the idea for simulation was like 2003, 2004. I mean, that really wasn't a popular thing. Mount Sinai had a clinical skills center with standardized patients. But I was at a chief learning officer conference, and I was going to present. And also there was a fellow called Mike Barger. Mike is one of the co-founders of JetBlue. He was also a Top Gun in the Navy. Himself and I were sitting there, and so he was a Top Gun, and I was an ER and a trauma nurse, and we're sitting amongst all these training and development people. And the thing that Mike and I had in common was our curriculums need to focus around safety, whether you're taking a flight up or a patient is being seen by a clinical team. And I asked him, how do you train fighter pilots? And he said, first you knock the chip off their shoulder, and then you put them through the flight from hell in a simulator. And I thought, we could use that. So Mike actually, we partnered.
You got to humble people.
Yeah. And so Mike helped conceptually us build that simulation center. So a lot of the pedagogy in the Sim Center is based on aviation.
Wow.
Crew resource management, that came from aviation. That did not come from healthcare.
Wow.
Et cetera. So he's still a friend of mine. He actually teaches at the Ross Business School in the University of Michigan. He's retired from JetBlue. He was aviation's first chief learning officer, like I was healthcare's first.
Yeah.
So the standardized patient program came once we knew we were going to have a medical school, because you need standardized patients.
Yeah, and let's just describe what that is. So they're SPs, standardized patients, and so there's various ways to run simulations. So and they all have their strengths and advantages. And so one is to have actual actors and actresses come in. And you want to talk a little bit about that?
So actually, they're not actors or actresses.
You're
We
right.
would recruit for people that wanted to be medical educators. I mean, that's how we approached people that would come. We didn't go out and look for nurses or doctors to do it. We did hire some, but we had to have them remove everything from their brain and follow the script as a patient.
Right.
And there was always ongoing hiring for that. It's very intense training, particularly when the medical school is coming for their high-stakes exams. The medical school spends more time at CLI, I think, than they do on the Hofstra campus.
Wow.
Yeah, and just on that point, so just look, you guys did a great job adapting it, and now we brought it over to the nursing school right on the third floor. We have a whole sort of wing of the school devoted to simulation. We have low fidelity mannequins without the consoles, high fidelity, and now I'm sure you've spoken with Christy Lowenstein, our dean, which we're actively working to try and move it forward with virtual reality, augmented reality, Sims. We're trying to incorporate that. But you mentioned, the medical school. I want to sort of delve a little bit into that collaboration and just even more broadly, just sort of the integration with MDs and, other healthcare providers, because, our school is nursing and PA.
Yeah.
And the medical school had a head start on us. It's a different type of...
and perfusionists, cardiac
and
perfusionists.
perfusionists, 100%. You've worked with Dr. Battinelli and you've worked with a bunch of people over there. Talk about that collaboration. And then just in the larger, scheme of things, what that collaboration in the real world is like and where we're going, moving forward.
The founding dean was Dr. Larry Smith. Actually, Larry hired David to be the chief academic officer. When it was time to build the medical school, Larry put me on a team and helped figure that out. I loved Pearls and the case-based pedagogy because who learns from lectures, right?
And let's just define Pearls.
It's patient explorations, active reasoning, and learning synthesis.
Right, very good. Okay, you can go home now, Kareem. Yeah, and it's basically a flipped classroom, case-based learning. So rather than me or Kareem or anybody getting in front of a lecture hall and giving a boring job, putting everybody to sleep, it puts a lot of the onus and responsibility on these students to collaborate. I mean, it's a collaborative effort. It doesn't work. If it, you could be a single student and go out and do your own research and due diligence, but this is a collaborative group effort. So, talk a little bit more about that.
Yeah, so there's pre-work. So the students have to prepare to come and run the case. And the students also make a decision who's going to be the team leader, who's going to be the scribe, who's going to be the timekeeper. So it's very learner-centric versus that old traditional model of teacher-centric. Right. Topics that you would actually do a lecture on, that's up to the student to come prepared. We don't baby the students, and the students do come prepared. You can't hide. The Pearls teams are 7, maybe 8. Everybody contributes. Once the case is run and the session is just about over, everybody talks about what they did well, what they could do better for the next time, and then they talk about how the team did and what the team could do better. So somebody might say, I really felt like I spoke too much, or I didn't contribute enough, but I will the next time.
Right. So being self-aware and
it brings a whole host of skills. We used to have this slide years ago when we first coming out with the medical school. It would be a lecture hall with the lecturer up front and nobody in the classroom.
Right.
Because all you have to do is pass the exam.
Yeah. And look, we've had great success with Pearls. Kareem could speak to this, mostly at the graduate level. Undergraduates,
tough.
Been a little bit of a challenge for all sorts of reasons. Maybe we could touch on that. But certainly for the graduate program, it's been an incredible success. Listen, I think it's not traditional. I think a lot of people come into it skeptical. I did. I was sort of, what is this? And a lot of students do, because it's like, what do you mean? You're not going to give us what we need to know. We have to work at this. And Kareem,
Right.
You went through this. What was your experience?
Yeah, at first, it's a culture shock, because you're used to learning your whole life with having a teacher in the front of the room and just lecturing you. But the God's honest truth is it's either one of two things is happening. Either you're not paying attention or you're zoning out and you're just copying their words to a piece of paper, and you never really go back and look at that piece of paper anyway. And if you do, you're not really memorizing it, right? So with Pearls, it's nice because you're identifying within yourself things that you don't know, right? So what are my learning objectives for the week? What do I need to know? What would I like to know? And then you go and you look that information up, and it's nice because when you come back, everyone in the room, part of the group, is almost taking the role of a professor. The second that you start speaking, if you don't know what you're talking about, your group members are going to check you. In that way, it almost reinforces the learning because it's like, oh, well, I got that wrong, or I don't really know that, or do we really have consensus on this? Do we really know what we're talking about? Okay, if I don't know that, I didn't look at it throughout the week, now maybe I need another learning objective that I have to go back and look this stuff up, right? How can I compare and contrast? Like, just as an example, a kidney injury, right? there's so many reasons why a patient might have a kidney injury, right? And to know the pathophysiology, the pharmacology that goes into that, physical exam findings, all of those things, and to be able to compare and contrast it, it's an education like no other. There's nothing like it.
Right, and you need faculty that's on board with it.
Right.
So if somebody likes to lecture, that's great, but then our schools aren't for you. Right? I mean, there's plenty of other schools you can go to. But you really have to enjoy the process of a learning environment for the learner and not a teaching environment for the teacher.
Right.
Yeah, I mean, part of that acronym for PEARLS is exploration.
Yes.
And it really is
Right.
an exploration. You know, you had mentioned a debrief, how important that is for this and for SIM, and it is. I mean, there are other aspects. Like you just mentioned a couple that are really important. Yeah, I mean, you have to buy into it. It has to be collaborative. And then just in terms of the physical setting, it's not a normal room. It's surrounded by whiteboards.
Right.
And so the students get up. A lot of it's not coming up necessarily with the right answer. It's coming up with the right questions.
Right.
And so they get there, the students have a case, they've done their research, and they get up on the whiteboards, and then, you know, even this already small group breaks up into groups of 2 or 3, and they get up on the whiteboard and have to figure it out. What do we know? What questions do we need to ask?
You both know from your patient care experience that you have to know where to go to get the answer.
Exactly.
Right? There's just too much information out there. There's no way you can memorize stuff anymore. So you have to explore the patient, right?
Absolutely.
And then the interconsult, you call the right consult, or, you know, what labs and what imaging studies, et cetera. Or you have to go and be able to look something up.
Right.
Right? Or ask somebody else.
Right.
And that's what's taught during the PEARLS process.
Yeah, and another aspect of it that really mimics real life is in healthcare, as in a lot of the rest of life, but certainly in healthcare, there is no particular scenario. We can come up with a 65-year-old male with diabetes, heart problems, whatever. And then you take that same scenario and the students come up with what we call triggers, right?
Right.
They're going to ask questions where they're going to challenge themselves and their colleagues. All right, well, now you have that scenario and you answer this question. You're going to give them this medicine, that medicine. Well, what if we changed it? Okay, what if it's a 14-year-old female? How does that change things? Oh, really? That's just a lot of what if.
What ifs, yeah, that's right. And then even the exams, right? The short essays.
Yes. Yep. I remember them
They
very
can
well.
explain that, but they have to explain their logic behind the question, not just pick out A, B, C, or D. Go ahead, Kareem.
Yeah, so I think that style of a question is so difficult because, and it's difficult in a good way, because think about it, like we're training to take care of somebody, right? So if you have A, B, C, and D, it's already given to you, right? You're just picking from options. But if they ask you a question, they give you a clinical scenario, like the style of the question is you get like almost like an HPI on the patient, what's going on, and then they ask you a bunch of
HPI, just for our
a history of present illness.
okay.
You get like this brief HPI, and then you have these prompts that ask you what's going on with the patient. Explain to me the pathophysiology behind this. Okay, this patient got such and such medication, they're having this side effect. Explain to me the PK and PD, or I'm sorry, pharmacokinetics and pharmacodynamics behind how this medication works. You have to actually sit there and write out how it works. It's not something that is like an automated prompt or, oh, I can just select A or B.
Right.
So it makes you think, you know, and that process of having that, struggling with that information and having to be able to explain that, it stays with you.
Right.
It's like riding a bike.
Right.
So,
Right.
you know, I think if I have to compare year one where you're doing these things versus year two where now you're going into a clinical scenario, it's like easier to talk to the patient. You start to think about these things. Oh, I remember this scenario from my simulation. I remember this from my exam. I'm able to speak to that. I'm able to explain it. It's, like I said, it's cutting edge stuff. It's just, you know, when you compare the way that this program was structured in comparison to other programs out there, it was way beyond its time. There's nothing ever like it.
Right. And it changes your whole mental model. You know, we can all memorize, remember it for 24, 48 hours, pick A, B, C, or D, be lucky on a lot of them, right? They used to say, if you don't know the answer, pick B.
Yeah.
This really makes you think, and it shapes the way you approach a patient. which is important. And I remember Mike Dowling saying to both Larry Smith and myself, if you're going to create the same type of schools that are already around, I'm not making the investment.
Right.
It's got to be different.
Yeah.
Right. So, it's all about innovation.
So you've been everywhere and done everything. So I just kind of want to, circle back. We talked about the med school and, there was tremendous collaboration there. And, within our own school, collaboration with, like you mentioned, perfusion. We have a physician assistant program. And here, Kareem and I are, I'm an MD and he comes from the nursing world. We're working together. But, in real life, it's not always that way. So what do you see sort of at the top leadership level within medicine and within nursing? Because, there's no secret. There's a lot of, the AMA has lawsuits, out there going in terms of scope of practice. Comment on all of that and what you see going forward.
Well, from my perspective, I was always interested in the whole organization, never a slice of the organization. In order to be faithful to the mission.
Which is taking care of patients.
Correct.
Yeah, ultimately.
Right. You have to be focused on the whole organization.
Right.
And we always said CLI is like Sweden. In many simulation centers across the country, because many times they have leadership development and simulations separated in other organizations across the country. Dowling said, nope, under one institution. This way, if I have any questions, I only go to one person, which is why he had both Dr. Smith and myself as the founding deans, because typically the deans and the healthcare organizations are not aligned, where we can only argue with ourselves, right? We're asking ourselves the same question. Being focused on the mission and moving the whole organization, you have to be collaborative. And we always got along. We were all on Mike's team, right? If you weren't a team player, you were not in a leadership position. It's just as simple as that. And you really had to believe it.
Yeah, you got to believe it. You can't do this on your own.
No, you can't. And you can't.
And going back to paroles, you can't.
You can't fake it.
You can't. You got to collaborate. You got to be able to communicate. And humility is a big part of it.
Yes. Yes.
Right?
Exactly. Yes.
If you think you know it all or could do it all, things are not going to work out well for you.
Yeah, it's deadly.
Your patients.
So I want to ask you a tough question.
Yeah.
You did all this work, right? Mm-hmm. Building up, I would even go as far as to say building up the nurse practitioner profession, right? Because the way that we were trained is, like I said, it's cutting edge. Where do you see the role of nurse practitioners in the future? Do you see nurse practitioners rising to the bar of maybe even being an attending, or not an attending, I don't want to use that word, but having that level of responsibility within the healthcare system? Or what do you think about that?
So certainly the nurse practitioners that are fully prepared, we have to take some onus on ourselves to make sure we are fully prepared for the job.
Yeah, high standard, right?
Very high standards, right. And then it comes to the employer, because essentially the employer decides the role that nurse practitioners will play. Some healthcare organizations, particularly in the Midwest and out in rural areas, they're running the show.
Sure.
You certainly can.
They have no choice out there, right? In a lot of places, right?
That's right.
Yeah.
Yeah. So Colesford, innovative thinking.
Right. Beggars can't be choosers.
Right. There you can, particularly mental health nurse practitioners. Many of them have their own practice.
Right.
Yeah.
Right.
Yeah. So it depends on the profession being adequately prepared, being able to work in teams, and then it depends on the employer, how they will utilize the nurse practitioner. And certainly, I always believe the marketplace rules, and that the NPs will shift to employers that allow them to work at the top of their professions.
So speaking about marketplace, I'm going to ask you an unanswerable question. No, really, it's $1 million question. It's the topic of the day. There is no answer, but I'll just, I'm curious about your opinion. AI. How is AI going to impact where we are in the next year, 5 years, 10 years in terms of healthcare?
When you look at prior to the term AI coming out, right? So the little device, Cardia,
The cardiomobile?
So where you put your fingers on it and, it tells you with some degree of specificity whether it's bradycardic or tachycardic or AFib or whatever. So that's been out there for years, right? That's been out there for years. So now with AI, they're just taking that to a newer level. Or, you do an EKG. On the EKG machine, you'll see where it'll say bradycardia or tachycardia or SVT or whatever. You see that there. For years, we've seen that. Mm-hmm. Now, of course, you have a clinician, come along and check that with their eyes. But, when you think of AI in radiology, I read that AI can be very helpful and actually, looks at X amount of mammograms and will triage to the top when the radiologist sits down. You have to look at these 5 first.
Right. Filter out. With
right. So there's certainly space for it. I mean, I can never see. Now, over at LIJ, they have the robot.
Right. Surgery.
Well, no, not the Da Vinci. I'm talking about the robot that can make rounds.
Oh, right.
With the physician's face in the center.
Yeah, right.
Yeah.
Oh, man.
But it's still a physician. It's just the robot, going in and out of the rooms, and the physician is in another building or whatever. So I think there's plenty of room for it to be able to make our diagnoses perhaps quicker. And then, of course, you always need the nurse practitioner, the physician, the PA.
You still need the human touch, right?
Yeah. I mean, I can't imagine any type of AI replacing the bedside nurse.
Hopefully not. Right?
I don't think it would replace a bedside nurse, but I think that, just as an example of one integration, if we had, if you think of, an interface of, ChatGPT or whatever, the Google Gemini, you're typing into a box, and the AI is spitting out something back to you based on what you typed. Well, what if there was something to train the nurse or the physician or the nurse practitioner that interface was pretending to be a patient, and now you're focusing on patient communication, how you can elicit an HPI or something like that. I think in training, it definitely can go very far.
Right. Dr. Alice Fenori, I think she's a little bit ahead of the game
really?
in doing that with her mobile training apps.
Interesting.
Yeah. Mm-hmm.
So we're coming to the end of this broadcast. Yeah. This has been, I know, we're going to have you back. We could talk for hours. But before we let you go, so I mean, with all the, changes just in terms of organizational and, this brave new world of AI and stuff, what's your advice or guidance for anybody considering a career in healthcare in general and nursing? And what do you tell your own grandkids?
I think nursing, to me, for somebody that had no intentions of being a nurse, and I started out as an LPN. So I've been every nurse in the world, an LPN, an associate degree nurse, a baccalaureate nurse, a master's prepared nurse, and a PhD.
That's great.
So I've worked in all different types of positions. So I really saw everything from the ground up. I loved every bit of it. Every time I would get to another level, it would just inspire me to study more and go for the next level because I enjoyed it so much.
You're an eternal student, for sure. Yeah.
Oh, I love learning. Yeah.
It's great for a chief learning
It's good for a chief learning officer to try to inspire others. But you can go to so many different places.
Right.
We all start as a bedside nurse, which is wonderful. You can stay there, or you can do advanced nursing, or you can go into administration, or you can become an educator. You can come off, like I always did everything around my family. When the kids were little, I was home, working every other weekend. You can get off the track, and you can get back on the career track. Yeah. Because there's always work.
Yeah, and you can do fast-paced, like ER type stuff. You can do slower paced.
I was talking to a friend of mine actually in the medical school, and she was saying, nursing, you're so lucky. Nurses can change their specialty
easier than
where
MD.
physicians would have to go and take another fellowship or an internship.
Yeah. Same with PAs, right? I mean, they have that,
PAs as well.
Well, Kathy, Dr. Gallo, really, this has been an honor.
This has
and
been
a
great.
Pleasure.
Thank you.
It's fun, and we'll have to have you back.
Thank you for memory lane.
Yeah. So this has been a production of Nurse to Health, brought to you from the studios of WRHU at Hofstra University in collaboration with the Hofstra Northwell School of Nursing and Physician Assistant Studies. Great thanks, as always, to John Mullen, our wonderful and incomparable engineer. And for my co-host, Dr. Kareem Nugdalla, and myself, Dr. Bob Gluck, stay well, and thank you for tuning in to another episode of Nurse to Health.